Hello everyone, this is Afroza Khan and I am a registered respiratory therapist. Today we will be doing a session where I'm teaching my patient the breathing techniques and also the respiratory muscle strengthening exercises. So this is my patient, Mr. Khan. Hello Mr. Khan.
Hello.
Hi. And this is the brochure that I made, and this is an education resource. The title of my education resource is Let's Breathe Better, and this is a copy for you. Okay.
Thank you.
And today we will be learning how to do some breathing techniques. So Mr. Khan has a history of COPD, and he has a 30-pack history of smoking. He has been diagnosed with emphysema. And he has been coming to our lab to do PFTs almost every year, once a year, to get the status of his disease progression. So with the history of emphysema, our hospital and our pulmonologist has decided that he needs the rehab. So he got the referral for rehabilitation, and today we will be doing this session for the breathing techniques. So Mr. Khan, as you know, and as we were learning since you have been diagnosed with emphysema, that this is a disease which comes under chronic obstructive pulmonary disease, and this is something, unfortunately, that you will be living with it. But now, with all the scientific data and also the research that we have seen that pulmonary rehabilitation and our daily routine activities, if we change certain, your lifestyle and your quality of life can improve by doing different small things that can help you and can help you to reduce your symptoms like shortness of breath, your mucus production, and it can help you to do your routine activities without getting out of breath. Okay? So the education resource that we have here is actually explaining how all the basic information about what is inhalation, what is exhalation, and how your lungs are helping you to inhale your gases and exhale. And it also tells you what is chronic obstructive lung disease, and it indicates that there are so many diseases under one umbrella, which includes emphysema that you have been diagnosed with. It has chronic bronchitis, chronic asthma, cystic fibrosis. So these are the basic information that you can read and learn about it. Okay. And on next page, when we go, it tells us like why the breathing techniques are important and why the muscle strengthening exercises are important. So like I said, that activities of daily living is very important, and we see that many of our patients with chronic lung disease have problems in successfully doing those or completing those activities. So it will be good. I would recommend that you should practice these exercises every day, and you know your body best, so pace yourself. You don't have to do everything at the same time, but with your routine walking and pacing yourself and doing and following these exercises will help you. Okay, so the very first one is the pursed lip breathing. So the very first exercise that we have here is pursed lip breathing exercise. So if you can follow, and I want you to read these steps and we will do it together. So I will demonstrate, and it will be nice if you can follow me and do it with me. Okay? So we will practice the pursed lip breathing first. Okay? So the very first step, it says here that while keeping your mouth closed, take a deep breath in through your nose, counting to 2. Okay? So the very first thing is you have to breathe through your nose and breathe out through your mouth. So the purpose of this breathing exercise or the technique is to give more time for you to exhale, to actually empty your lungs. Okay? With emphysema, what happens is when you breathe in, you take the air but the breathing out is difficult. So what happens is your airways are closed and you cannot completely let the complete air out, okay? And it's called air trapping, okay? So we'll practice so that we give more time for your lungs to let the air out, okay? So now we'll do it again. Breathe in through your nose and excellent, very nice, okay? Let's do it one more time. Breathe in through your nose, smell the flowers and blow the candles. Okay, and this is the exercise we call pursed lip breathing, okay? And to make it easier and to make you remember, we tell our patients that smell the flowers through your nose and blow the candles through your mouth, okay?
Okay.
So that's our first exercise. Now second one is the diaphragmatic or abdominal breathing, okay? So if you can read through these steps, and as you know, the diaphragm is a muscle which is a dome-shaped muscle that divides your chest cavity and your abdominal cavity, okay? So this is the muscle, and it's the largest muscle that helps with your breathing, and it divides your chest and abdominal cavity. So we will do this exercise to make this muscle stronger, and once this muscle is stronger, it will be easier for you to help you breathe better, okay? So for this exercise, let's read these steps. While sitting or laying down with your shoulder relaxed, put a hand on your chest and place the other hand on your stomach, okay? So one hand should be on your chest. You can keep the brochure down, yeah. And then one on your abdomen, okay? And breathe in through your nose for 2 seconds in such a way that your stomach moves out more than your chest. So breathe through your nose, but use your muscle, your stomach should go out. Okay, and then purse your lips and slowly through your mouth blow out. So now right now diaphragm, the muscle, is helping you to release the air, okay? So you are doing two things at the same time. You are letting all the air out and you are making your diaphragm stronger too, okay? So let's do it one more time. Okay, breathe in through your nose so that your stomach is coming out, and breathe out through your mouth like we did with the pursed lip breathing. Excellent, slow and easy. Let's do it one more time. Breathe in through your nose. Very nice, okay. So now this is a combination of pursed lip and diaphragmatic breathing, okay? And let's go to the third one. If you have any question, Mr. Khan, you can stop me and I'll review it again, okay?
Sure.
Okay. Now the third one is the huff cough breathing. This is huff cough because it helps you to bring up the mucus, okay? Like with all the chronic lung diseases, it happens that when you have a lot of mucus production, especially with the history of smoking, and it's hard because your lungs are not as stronger as before. It's hard for you to bring up the mucus. And once the mucus retains in your chest, then it can cause some infection like pneumonia. So we want it to come out, okay? So this exercise, the huff cough, will help you to bring up the mucus, okay?
Okay.
So let's read this together. So when you have chronic obstructive lung disease, mucus production is high in your lungs. The huff cough is a breathing exercise that helps you cough up mucus effectively. So it assists you without making you too tired, okay? Now place yourself in a comfortable seated position, which you are. Now take a deep breath through your mouth, in through your mouth, and then use your stomach muscle to blow the air out in 3 even breaths while making this sound. There you go, very nice, good job. So one more time. So you have to take a deep breath through your mouth and out through your mouth. Very good, excellent, okay. So let's do it one more time. Breathe in through your mouth. Excellent, okay. So you are making your airways to bring up the mucus. So that will help you to get rid of mucus. Okay, so that was our third exercise. Now the fourth one is a deep breathing exercise, and this one is as effective as the other one. And deep breathing is always good when you have chronic lung disease, because it will keep your lungs expanded, and when your lungs are open, there are less chances of getting sick and getting pneumonia and getting hospitalization. Okay, so deep breathing you can do anytime when you are sitting and watching TV, or reading your book. You can practice this exercise. So for deep breathing, you have to sit nicely with elbows slightly back, so your chest is completely expanded. So we want your chest to be open, and then take a deep breath through your nose, which kind of a little bit harder, but try. And hold your breath for 5 seconds. Now release the air slowly and deeply through your nose until you feel your inhaled air has been out. Okay, so let's practice one more time. The holding of air is important here. Okay, hold your breath for 5 seconds and breathe out. Excellent. Okay, let's try one more time. Take a deep breath in. Hold your breath. Hold it, hold it, hold it, and blow. Excellent. Very nice. So these were the 4 exercises that we practiced today. Okay, and now we will see what are the muscle strengthening exercises that you can do. Okay, so I have listed some exercises that you can do in your routine activities. Like make exercise part of your daily routine, the first thing. So make sure that you are motivated and try to do your medication, take your medication as it has been prescribed by your pulmonologist, and have your rescue inhalers close to you, so just in case if you are out of breath, then you can use those. Okay, and make sure that you are stretching your arms and legs while watching TV. So when you are doing and moving your muscles, that time your oxygen requirement increases, and when that happens, then your heart is actively pumping the oxygenated blood, and you are breathing better. Okay, so try to move your muscles, your arms and legs. And the other thing will be park your car a little far from a store, so you can walk towards the store. So it's basically you are trying to tell your body to move more. Okay, so and then you can go to your favorite grocery store and try to walk around the store and see if you can take some get some steps. Okay, the other thing is there are 3 important exercises that I have listed here. The aerobic exercises or endurance, where you can go for walking, biking, and again it's as per your like what you are feeling on that day. Okay, so you don't have to push yourself or force yourself. Do what you can do. Okay, the flexibility exercises are stretching. The other one is strengthening exercises like lifting weights and using resistance bands that the rehabilitation team will provide. Okay,
Sure.
and the other thing that I have listed here is incentive spirometer, which I have it here. Let's practice that. And it is just an extra device that our lab provides to our patients. Usually it is given when patients are admitted, and it is a very good and excellent device where you can practice deep breathing. And show you. It motivates you so you can breathe better. So you can hold it here, and you have to breathe in so that this blue bellow move. Excellent. Okay, and you have to again pace yourself. You don't have to do many deep breathing one after other. Try and take a break and take a deep breath in again. And you have to go slow and easy, nice and easy. You can take a break. And out. Very nice. Can you feel your lung expansion? Right?
Yeah.
Okay. So that will help you to keep your lungs open, and again, because your lungs are open, there are less chances that you will get any kind of infection and pneumonia. So now let me tell you like when to stop exercising. Okay, if you have any kind of pain or discomfort, or your chest is heavy, if you feel that you're gonna be you are feeling dizzy, or if you are too short of breath, or if you are lightheaded, we don't want you to go into any kind of risk. So you can stop the exercise and give yourself a break. Okay, and the other thing is when to stop exercising, as well as what are the steps that tells you how to stay safe. You should follow the guidelines that has been given by the physician as well as your rehabilitation team.
Okay.
Drink plenty of water before, during, and after the exercise. Keep your rescue inhalers right close to you, which is like within your reach, and just in case if there is any kind of emergency, call 911. Okay, so I hope these exercises will be helpful for you to use in your daily routine activities. Try to do as much as you can. Okay,
Sure.
and please let us know if you have any questions, and follow these exercises and the breathing techniques and strengthening exercises. Hopefully this will help you to cope up and improve your quality of life.
Sure.
Okay,
Thank
I
you.
hope this was helpful.
Yeah, it was very helpful. Thank you.
Thank you.